This exercise is called the human scavenger hunt. It will help you get to know each other better. Dementia is not a specific disease. It is the term that describes a wide range of disorders and symptoms associated with a decline in memory and at least one other thinking skill, such as concentration, orientation, language, judgment, physiospatial skills, and or sequencing. In this training, we are going to talk specifically about dementia among nursing home residents. By the end of this module, you will be able to define dementia, identify the symptoms of dementia, identify the irreversible types of dementia, identify other conditions that might present with symptoms that can look like dementia, recognize that dementia affects people differently, develop empathy for persons with dementia, and understand what we must meet persons with dementia in their world. Let's get started with the first lesson. What is dementia? The goals of this lesson are to help you understand the term dementia and the symptoms commonly associated with dementia. Today's lesson is about understanding dementia and the world of residents who have dementia. Dementia isn't a specific disease. Instead, think of dementia as a broad umbrella term that covers a group of disorders with symptoms that affect a person's cognitive, physical, and social abilities severely enough to interfere with the person's daily life. Most people with dementia are older, but it is important to remember that not all older people get dementia. Dementia is not a normal part of aging. Dementia can happen to anyone, but it is more common after the age of 65. However, people in their 30s, 40s, or 50s can also have dementia. Think of dementia as an umbrella covering several different symptoms. Memory. This is the number one symptom that we've all seen. Each of us can identify residents who have memory loss. Do you have any personal experiences dealing with residents with memory loss? Concentration. Mr. B used to enjoy sitting in the living room area watching detective shows, but he doesn't seem to have much interest anymore. Now when you turn to his show, he sits for a bit and then gets up and goes to his room. Mr. B may be having trouble concentrating on the plot. His memory loss and lack of concentration make it almost impossible for him to follow the storyline and to understand what's happening. Orientation. To who, when, where. Residents may not be able to understand where they are, who they are, the date or day, or even what time it is. A resident may come out of her room at 9 p.m. fully dressed, looking for breakfast, thinking that this is morning instead of evening. She may think it's the year 1944. She may be looking for her children or her mother. This is her world. Language. Have you noticed any of our residents having difficulty with their speech, trying to find a word that just isn't there, saying cat when they're pointing to the chair? You will notice that their ability to understand what you are saying and to communicate what they are trying to say gets worse with time. Do you have any personal stories or experiences with residents who have had a challenge with language? Judgment. We know not to touch a cookie tray when it just comes out of the oven. We know to put on shoes when we are going out in the snow. A person with dementia, though, may not be able to make these simple decisions. The judgment skills of a person with dementia will get increasingly worse as his or her condition worsens. Physiospatial skills help us figure out how objects relate to one another. In other words, they help make sense of what we see. Those skills decline in persons with dementia. This video shows a resident who is experiencing a decline in her physiospatial skills.
having lasagna. Your favorite. What's the matter, Mrs. Caputo? Is this stuff in your way? Here. All right, that ought to do it for you.
I can't. I'll fall.
Mrs. Caputo, look at me. It's Lynn. It's okay. Here, take my hand. I'll help you. That's right. You know I wouldn't let anything happen to you. We're in this together. Wonderful. Here we go. There you are. Are you feeling better now?
Yes, thank you.
Good. Now let's go get some of that lasagna I saw in the dining room.
Thank you.
Yes. I love lasagna.
Oh. Okay.
Here we are.
Okay.
Yeah.
Okay.
Wonderful.
Okay.
What did you see happening in that clip? What was Lynn's reaction? Sequencing means being able to do things in certain logical order. There are many things that we do every day without even thinking about them. They are natural for us. For a person with dementia, even the sequence for performing basic activities can become confusing and complicated. This video clip shows a resident who is experiencing decline in sequencing skills.
Okay, Miss Caputo, here are your clothes. I'll be back in a minute, so why don't you go ahead and get dressed, okay?
Okay.
All right. It's me, Heather, Miss Caputo. I'm back. Oh, let me help you with your socks. Okay, you hold that. All right, now let's put your socks on.
Oh.
There you go. Now your shoe.
Oh.
What did you see happening in that clip? What was Heather's reaction? One thing I want to point out to you is that the aide, Heather, let Mrs. Caputo get dressed on her own. When Heather came in, she saw that Mrs. Caputo was having trouble with her sock and putting it over her shoe. She calmly removed the sock, handed it to Mrs. Caputo, then helped her with the shoe. She let Mrs. Caputo put her sock on herself. This is an example of giving the resident just the right amount of assistance, not too much and not too little. Here we see all the symptoms of dementia that we discussed. Do you have any questions of them? In this lesson, we have learned that dementia is an umbrella term that covers a group of disorders with symptoms that make normal life increasingly difficult for our residents. We have learned that we need to be there for our residents to assist them and their dementia symptoms as their dementia symptoms worsen. The goal of this lesson is for you to understand that irreversible types of dementia and conditions that may present with dementia-like symptoms. There are several types of irreversible dementia. They are progressive and will continue to get worse. While medications can slow the progression of these types of dementia, they are not a cure. We can think of these different types of dementia as being under the umbrella of dementia. Alzheimer's disease is the most common type of irreversible dementia, accounting for 60 to 80% of dementia cases. Vascular disease. A person can develop vascular dementia after a stroke blocks an artery in the brain, but strokes don't always cause vascular dementia. Factors that increase the risk of a stroke include high blood pressure, high cholesterol, and smoking. Also raise the risk of vascular dementia. Persons with Lewy body dementia are commonly misdiagnosed with Alzheimer's due to the loss of memory or with Parkinson's disease because the appearance of tremors. However, people with Lewy body dementia may also have visual hallucinations and moments of confusion interspread with complete clarity. Persons with mixed dementia have symptoms of more than one type of dementia. The example, they may have brain changes associated with both Alzheimer's and vascular dementia. This type of dementia may be more common than previously thought. Parkinson's. Have you seen anyone with hand tremors? That is the common physical sign of Parkinson's. Can you name a famous person with Parkinson's? There are a number of less common types of irreversible dementia. They include all of the ones listed to the right side of the screen. Irreversible dementia is progressive and does not get better. There are reversible conditions, though, that might result in dementia-like symptoms, including B12 deficiency, medication side effects, depression, thyroid or endocrine problems, infections, electrolyte problems, and dehydration. Many residents also have common conditions including constipation, acute or chronic pain, lack of sleep, and others that cause discomfort and can make dementia symptoms worse. These conditions may be confused with irreversible dementia symptoms, but they can often be treated, and in most cases, the symptoms of dementia lessen or go away. They must be recognized and taken care of to prevent them from getting worse. If a person with dementia also has any of these conditions, you may see a worsening in his or her usual dementia symptoms, including increased problems with communication and behavior. It is important for you to be the eyes and ears in noticing changes in a resident, particularly if a resident suddenly has dementia-like symptoms or the symptoms get worse. For example, you are caring for Mrs. Caputo. She usually dresses herself, as we saw in the video clip, but you notice increased confusion. You leave her clothes out, and when you return to her room, she is still sitting in the same spot, not dressed, and looking confused. Something else may be going on with her. Delirium. Any sudden change in a resident's medical condition or new medication can cause increased confusion or problems with thinking and functioning, especially in persons with dementia who become ill. When a new underlying medical problem such as dehydration, pneumonia, or a UTI is causing these symptoms, that is often called delirium. People with delirium may seem very alert one moment, but very sleepy within a short time. They are more confused and may have more trouble than usual paying attention to things. This is why it is so important that caregivers really know each resident. Most often it is the nurse aide or family who will notice a change in the person's change in the person with dementia, and that change could be delirium. Delirium is also due to new or worsening medical problems. It is very important to notify the nurse so that they can assess the person further. Delirium usually improves once the medical problem is diagnosed and treated. Lack of sleep. Those of you who have had or had a young child know what it's like to what it is to go without sleep. It can cause you to lose your memory. You can feel as if you can't concentrate. You may have no idea what day it is, and you may have lost your ability to speak with adults. You can't find words when speaking, and your whole mind feels fuzzy. Maybe a resident is suddenly acting differently or having problems performing activities she could do before. Could it be that she's dehydrated? Have you ever seen a movie where the people are wandering in the desert without food or water? Often in these movies, these characters rush to the oasis filled with cool, fresh water only to find it is a mirage. The type of hallucination is an example of dementia symptoms caused by dehydration. As you can see, the fact that a resident has an irreversible disease that causes dementia doesn't mean that other conditions won't cause new symptoms or aggravate his or her existing dementia symptoms. If you see any change in ability, communication, or behavior from what is usual for that resident, please tell a nurse. If you are the person who needs to let the nurse know about the change. Be the advocate for your resident. Be their voice. In this lesson, you've learned that there are several different types of irreversible dementia. You've learned that if you see a change in any of your residents from what is normal for them, you need to tell your nurse what is going on. The goals of this lesson are to understand what dementia is, that dementia is a brain disorder that a resident's actions and reactions are directly related to how the brain is being affected, and to know what it feels like to have dementia and understand the frustrations that persons with dementia have, and to understand why we must meet persons with dementia in their world. In this lesson, you will participate in a short exercise and watch 2 videos to help you better understand the world of a person with dementia. In this exercise, I'm going to hand out a brain coloring sheet. I want everyone to pick some crayons up, write your name above the brain on the left side of the page.